So if you've ever been wondering how different diagnoses like OCD, autism, and ADHD seem to co-occur with eating disorders, that's what I want to dive into today. So the first question we're going to dive into is how can these different diagnoses actually influence eating patterns and food behaviors, and that we can see that may eventually co-occur with eating disorders. And in a big part of this, it's because the brain just has some different patterns that it's been following. I know that can sound really general, really vague, but we do see that how we present with food can be different as a result of these diagnoses. So, a few examples I think is the easiest way to try to describe this. So, I think of someone with autism, for example, they might struggle, not everyone, but they might struggle with sensory sensitivities. So, texture and taste and the presentation of food can really impact how they feel they're able to eat that food. So, they may accidentally, as a result of how their brain is responding to food, end up in a more restrictive situation where they aren't eating as wide a variety of food or they're struggling to eat enough of a balance to get what they need. And that can then lead to restriction that can fall into more eating disorder like patterns. Or, for example, some of our neurodivergent uh, individuals, so those maybe with autism, maybe with ADHD, or maybe both, they can sometimes really struggle with just feeling their hunger, noticing hunger, fullness cues. And so they might just kind of live life until hunger or those internal sensations feel extreme. And then all of a sudden, we're having to react to food in a more urgent manner, or it can create a bit more of an anxious sort of reaction to food. So we do see that show up. And actually, those same individuals on the flip side, this is why everyone is going to be so individual. They might actually also feel their internal sensations in a more intense way. So we really want to make sure we're targeting the individual, but it's the different ways that their brain is working that's impacting the symptoms that can then lead to some of these disordered eating patterns and food behaviors that then may lead to full-blown eating disorder diagnosis. So the next question that I'm going to cover is why are eating disorders sometimes missed or misunderstood with people for people with OCD, ADHD, and autism? And unfortunately, the eating disorders are often missed when the food behavior is more attributed to the diagnosis than it being an eating disorder behavior, or we're not seeing it through both lenses. And when we're only seeing it through a bit of a tunnel vision, we might notice that, okay, well, your food behaviors seem a bit off, but we're not catching the fact that it's actually deeper rooted and becoming part of, or has already been part of, the eating disorder itself. So, one example that stands out to me for this would be thinking about someone with ADHD who is taking a stimulant medication, right? So, unfortunately, most stimulant medications can really impact appetite. And so for that individual, they may not have much of an appetite. We may see them not eat much during the day and then have some big urgent resulting hunger later in the day. But that symptom, that restriction during the day, might actually be attributed more to the medication. And that's where maybe clinicians are trying to target instead of actually stepping back and saying, hey, is this actually an eating disorder restrictive pattern that's showing up? So when they're sometimes missed, really what we're seeing is that the symptoms are attributed to the other co-occurring diagnosis instead of attributed to restrictive or non-restrictive eating disorder behaviors. The third question I want to dive into is how does nutrition care support regular eating and nourishment for neurodivergent individuals? Well, it's really interesting because it's both individualized and very generalized. So, nutrition care, we're always going to start with building the foundation of nutrition to make sure that someone is eating often enough within their food preferences and their food patterns and capability. We're going to make sure they're eating enough, and we're going to work on some of the balance that is showing up for their foundation of nutrition. Now, what that looks like for someone who might be neurodivergent, so with ADHD or autism, then with that, it might look a little bit different, right? So, for example, someone with ADHD who had those stimulant medications that I was talking about, we might have to really structure preferred foods or foods that don't feel so filling, or we might have to have some cues and reminders to eat what to get eating often enough and to hit that foundation for them in a way that's really when that medication is acting. And then outside of the medication acting, we might be able to support a bit more of larger volumes or different types of foods because there might be some real hunger showing up there. Um, but for someone with, say, autism, where they're, again, let's say the specific individual with autism also has some texture sensitivities, the way we might help them get enough is going to be really catered to their individual food preferences as we expand them to make sure they're getting that balance. So that nutrition care, the way it supports is by helping them build the foundation, but in a very individualized manner. So the final question for today is, when is it helpful to seek additional professional support? So I'm probably biased because I work in this area. I will own that. But I think early and often, the sooner we can help support someone who with their food behaviors, help build that foundation, help individualize their care, the more likely we're able to lay those patterns down in a way that feel habitual and aren't so hard to break, right? So thinking when you have new diagnosis, let's refer to a dietitian so we can help support if that dietitian is trained in that area specifically. So early and often would be my major guidance. But the other thing we want to take into consideration, and I want to be very careful with, is if we have someone who already has a malnourished brain, we have to re-nourish that brain. And then we might actually have to look at reassessment for what other co-occurring diagnosis might be showing up. So in particular cases, for some of our longer and more enduring eating disorders, a trend that I see, a pattern that I see, of course, this is not true for everyone, is that there might be a strong link there with OCD. So, one of the diagnoses we were talking about. And to be really honest, I can't just assume that a renourished brain is going to now not have those symptoms. So, I want to reassess once there is a renourished brain so that I can help tailor treatment that works alongside those co-occurring diagnoses. So that might involve a psychiatrist, trained psychologist with assessment. It might involve doctors. So really making sure you have a full care team is essential and really helpful for getting the best treatment and the best care plan all around support.